3 people are dead, 8 infected across multiple countries. A luxury cruise ship stranded at sea for weeks, refused entry by port after port as governments argued over who was responsible. And the reason? A virus so lethal that in some outbreaks it killed between 30 and 60% of the people it infected. This is not a movie script. This happened in 2026 aboard the MV Hondius cruise ship, and suddenly, one question started spreading across the world. Could hantavirus become the next pandemic? Hantavirus is not new. Scientists believe it has existed for thousands of years, carried silently by rodents. Humans are accidental hosts. When people come into contact with infected rodent urine, saliva, or droppings, the virus can enter the body, usually through inhalation. There are around 50 known hantavirus strains. In Europe and Asia, they mainly attack the kidneys and cause internal bleeding. In the Americas, the disease is even more severe. The lungs begin filling with fluid, the heart struggles to function, and mortality rates can reach nearly 50%. Unlike COVID-19, hantavirus does not spread easily between humans. In fact, among all known strains, only one has ever shown confirmed human-to-human transmission, the Andes virus found in Argentina and Chile. Even then, transmission is extremely limited. Scientists believe it requires very close and prolonged contact with someone who is already seriously ill. That detail is critical, because viruses capable of causing global pandemics usually spread before symptoms even appear. That's one of the biggest reasons experts say hantavirus is unlikely to become the next COVID-level event. But then came the MV Hondius outbreak. In April 2026, the expedition cruise ship departed from Argentina, carrying around 150 passengers and crew from more than 20 countries. One passenger, a 70-year-old Dutch tourist, had spent months traveling through remote parts of South America before boarding. A few days into the voyage, he developed symptoms. Shortly after, he died aboard the ship. His wife later died after leaving the vessel, and additional passengers began showing symptoms linked to Andes hantavirus. As fear spread, countries started refusing the ship entry. The situation quickly became an international crisis. The CDC elevated its emergency response level. The World Health Organization sent experts directly onto the ship, and passengers were eventually evacuated wearing hazmat suits. By May 2026, several confirmed and probable cases had appeared across multiple countries, with 3 deaths linked to the outbreak. Naturally, panic followed. But when scientists analyzed the numbers, the bigger picture became clear. Even in the worst possible environment for transmission, a crowded ship trapped at sea for weeks, the virus spread to only a very small number of people. That is not how a pandemic virus behaves. Pandemic pathogens need speed. They need silent transmission. They need infected people moving through cities before anyone realizes they are sick. Hantavirus fails almost all of those conditions. Still, experts warn that the virus should not be ignored. Climate change, shifting ecosystems, and expanding rodent populations may increase human exposure in the future. And perhaps most concerning of all, there is currently no approved vaccine and no specific antiviral treatment for hantavirus infections. For now, the science is clear. Hantavirus is not the next pandemic. But the 2026 Hondius outbreak revealed something else: how quickly fear can return when the world sees even the possibility of another deadly virus emerging from nature. Because sometimes it only takes one traveler, one remote location, and one invisible pathogen to remind humanity how fragile the line really is between our world and the wild.